I'm Dr. Jennifer V. Brown, your stroke specialist, and today we're going to discuss why the plantar flexors are important in terms of foot drop. So, the plantar flexors are part of the posterior calf muscles as seen by the arrow here. And in picture A, if there's increased tone in those plantar flexors, the gastroc soleus, the foot will just drop down in the midline. However, if there's increased tone in the posterior tibialis, the foot will drop down and turn in. And whether there's increased tone or not, or there's no opposing force to pull the foot up through the tibialis anterior, the Achilles tendon may get tight and shorten, and eventually a contracture may form, giving the appearance of foot drop. So, why are the plantar flexors important? Well, during pre-swing, the plantar flexors work concentrically to push the foot off and get the body forward to increase walking speed. However, in that position at pre-swing, there's a stretch on the anterior dorsiflexor muscle, the tibialis anterior. And this allows for an automatic recoil once the foot is lifted off the ground before the muscle works concentrically to pull the foot up and hold it in place. So what do I do to strengthen the plantar flexors? I use elastic bands. When I ask the person to push down against the band, the plantar flexors shorten, and that's concentric activity. And then I ask them to hold it in place. That's isometric muscle activity. And then I say, let your foot slowly come up against the resistance of the band. That's eccentric muscle activity. Please note that the plantar flexors work eccentrically in stance phase when the foot is on the ground, when the body is coming right over the ankle joint to in front of it. I'm sure you've seen the videos about that for strengthening. Remember, I'm your trusted source for stroke neurorehabilitation. And don't forget about the references, evidence-based practice. Thank you.